If you use an A for a B, C, D, E, F, G, it may or it may not work that well. Okay. After that, after this lecture, I will do a demo for you. Okay. Next. Now the mechanism is very easy. Okay. The sizes is 2 nanometers. The world's smallest virus is 27 nanometers. Okay, and we are talking about 2 nanometers, so it's very small. Your skin pore is 50 to 75 nanometers, and we are talking about 2 nanometers. That's why it can penetrate in very easily. Okay, it's nano size. Okay, a lot of people will say their product is nano. When we introduced nanotechnology to Asia, or our cosmetic to the whole world, there was no one talking about nano at that time. And that was in the early 2000s. When we introduced the products to the world, and where we won 3 awards, okay, it was very raw and new. Of course, competition sets in, people like to follow, they use the word, just like when we came up with the word biomolecular to Asia, not many people use that word, okay? Or just like when we say stem cells in 1985, when we start stem cell research in Germany and Switzerland, no one understand what is stem cells or peptides, you know. So the principle here is the same, the mechanism. The IGF, the growth factor will be enhanced, and the cell divisions process will be stimulated and they increase, okay? And these will extend the anagen phase of the hair, the growing phase, okay, to grow the hair. So here we are talking about the eyelash. The eyelash, you're losing 5 eyelash a day, 5 to 6. Because the lady is applying a lot of mascara and doing a lot of things on her eyelash. So every day you're losing around 5 to 6 minimum a day. So you continue doing it, you're losing. So obviously you have to apply something to grow it back. Otherwise you will lose all, okay, or many. Next, please. So the application is simple. It's still using a lash, a soft lash, you know, and you brush along it just like you would do with your makeup. You know, it's the same principle. After removing with your hair removal, you know, your makeup, and then you clean it up and then you apply this. And it's good to apply it before you sleep because it works better during the sleep, because regenerations will only come in when you sleep. Regenerations does not work when you're awake. So it's good to apply hours or 1 or 2 hours before you sleep, you do it. It's not difficult, you just apply over it. It won't take a long time after you're doing makeup all the time, all right? Next, please. Now, these are real results. So the eyelash, this is the one with the eyelash. We work on the lady. There's no adulteration here because this is a publications. Everything is not Photoshop or Adobe. Here, everything is done as it is, you know, and the results are given to the authorities and they publish the result for us after verification in UK. Next, please. Again, this was on another picture showing the growth of the eyelash. Next, please. Again, we did some other measurements to compare, and you can see there was an actual growth of the eyelash and more in quantity. Next, please. Again, the before and after picture. And you can see a longer eyelash from the eyes here. Okay. Next, please. Okay. Now, again, with pigmentation and other things, we can do all this again. Okay. So the penetration of the needles are different, are given differently to you according to the packs you order. Okay. And if you were to look carefully here, we are going to stimulate the collagen and growth, the formation of new collagen, and extend the elasticities to a certain extent. Okay. Now, look carefully at the sample and the sizes. Okay. Home use and professional use. Professional use means it had to be done by a medical doctor. Okay. If you look carefully, most of the time for your home use, you're using 0.25. Okay. Whereas your doctor, when you go, he can also use the sample. He will use a 0.5. Because I will also encourage the doctor to use the sample these days. Because I'm going to put in and one time is 25. 20 needles. Whereas you go by one with the aesthetic needles, you have to do it 20 times. So if we are talking about doing a few hundred times, it can be also tiring, a few hundred times for a patient, and you have 10 patients a day. So by the end of the day, you also have some strain on your hands, you know. So this is the way to move. Now, for stretch mark in the tummy, it depends. Some have very big tummy. There are more fats there. So you can even use needle for professional use up to even 1. Okay, 1, and some can even use 1.5. It depends. Okay, but for the patient, we will always say non-medical, we will give you a 0.5. And in the worst scenario, we will give you a 0.6. Okay, just like we will give you for your hair. Your hair is 0.5 for your information. Okay, or 0.6, depends. Next, please. Now, again, there's so many other things here we talk about. Prevention of hair loss, regeneration of the hair follicles. You know, it's not just to maintain the hair. You also have to make sure you have good hair, good, strong, thick hair, not thinning hair, because as you age, your hair is getting thinner and they start to curl too because they're getting very thin. Okay, so they don't have the tension anymore. So you look at the hair of a person, it also tells your health of you. Your hair will tell the skin and the nails of you too. They are linked. Okay, your hair will show the nutrition in your body. All the heavy metals can be detected from the hair. The strength of hair at the back thickened up, we can detect all the different heavy metals you have in your body. At the same time, we can also detect the deficiency or the excessiveness of certain minerals in your body. Example, calcium, zinc, everything we can detect just with a device which we have in the clinic. Within 3 minutes, we can detect everything there. Or we can take your hair and send for analysis. We can do that too, okay, apart from doing it with the blood. Now, next please. So I have already explained the simple step here, very easy, you know, open up this, open it up, and then load the liquid inside, okay, and then start to fill it up and start to stamp and sterile it, okay. Now I will finish all this and then I show you the demo one more time, okay, with my nurses. Next, please. So then you cleanse the bottle, you do the needling, you do the absorption, and then what happened next? Okay. Now, when you are doing stamping on your face, please bear in mind there are still needles. That means you have invisible wound. Just like you visited the aesthetic clinic for some laser treatments, they are wounds. They are invisible wounds. You can do a thermage, or you can do some HIFU treatment, or you can do some pico. They are still wound. So a lot of the aesthetic doctor will tell me, Mike, there are some inflammation. What should I be doing? So we give them an idea. There is a wound. We have to speed up the wound healing. We don't want the redness to stay on too long. So we recommend a 3-hour placenta serum to apply in the clinic, even after the treatment. Okay. But for the patient, they can also buy it home and do it themselves again, because this is aesthetic, this is a skincare, considered a skincare product.